please test how I can share?
Of course.
I'm hoping that I can just share screen and then tell me when I'm co-host.
You should be able to share a screen even without me making you co-host, Barbara.
Okay. So.
I'd be happy to make you co-host if you like, but.
So first of all, let me, okay, so share screen. So I want to put up my PowerPoint first. And then what would happen if I went to, can you see that?
Yep.
And that?
Yep.
And that?
Yep.
Okay, so I'm ready.
That sounds great.
So I should stop sharing right now, correct?
I think I would, yeah.
Thank you for this opportunity.
You betcha. What I was hoping to do as well, Barbara, was to go ahead and we do have a couple more. We have a couple of announcements and brief things before you come. Before we have you do your part for us. So we look
I
forward
have some flexibility in timing. I have a video that Dr. Godfrey made of his time in Kenya. Obviously,
Excellent.
it's not Nepal, but it gives people some idea of the impact in Nepal. And then I have my PowerPoint. So if we don't have time for that video, that's fine.
And when you get to the video, just remember, we'll need to make sure you check those boxes so you get the other, you get sound to play properly and so forth.
So I'm a little confused about that, but the video is embedded in the PowerPoint.
Oh, okay, good. But I mean, when you go to share your screen, it's important to bear with me for just a second. I've got to get into a different view here, so bear with me for a moment.
Hello, Oren. I appreciate your signature on many of my grants. John Winston does such a fantastic job, doesn't he?
He does. He does. He's, yeah, absolutely.
Hi, Mike.
Hello.
Hi,
Long
everybody.
time no see. What, since the district, I mean, the avenues of service, I think, is when I last.
I believe that's true. That was like 5 years ago, it feels like.
So, Mike, you're doing a World Vision stuff, right?
That's correct. And my counterpart, Stance, just hid herself.
Well, it's funny. I was cleaning out some old files, and I found something I picked up at the last Rotary convention I was at, which was a long time ago, long time meaning 5 or so years ago. And at the time, they were in the House of Friendship, and I said, "This is an interesting organization," and I picked up this flyer. And that was probably, I'm trying to think, 2018 or something like that. So.
Oren, where Oakland 3 is contributing to the Honduras project that's World Vision.
Right. And we're trying to work on this Guatemala one, as you know, so, or you may not know. But at the time I thought, well, these guys are covering water what are we doing? And it does have Rotary and World Vision at the back of the flyer.
Yeah, it seems like a great partnership, and I'm impressed with how they have been doing their projects.
So they did, so I see Haiti and Wash, so were they involved in the hand wash stuff?
So Oren, that was it was a referral announcement. We'll see whether they're able to join us or not, from Jill about one of her colleagues she works with on hand wash. But this particular global grant they're interested in sharing about is separate from that. It's
No, I know that. I'm going back on this flyer, seeing a $2 million thing back in
okay.
somewhere.
Okay.
The sponsoring club was in Minnesota, so.
Oh, you sure that wasn't Honduras?
No,
They're I think Minnesota's involved in the Honduras project.
you're right. There was okay, here's a Honduras, 1.4 million.
Hi, Wendy.
Time.
Hello, Barbara. How are you?
That was a St. Louis Park in Minnesota. It's a different one than this other one. So interesting.
That's where I'm from.
Oh,
You
That's
betcha.
where I'm from. You betcha. I was
You
born
betcha.
in Minneapolis, and at a year we moved to St. Louis Park, and at 7 years we moved back to Minneapolis.
okay. So where is Safe Water, Minnesota?
St. Water? You
Yeah,
mean
it
St.
says
Paul?
Sponsoring club, Safe Water, 5950 St. Water. Anyway,
No, I don't know.
I guess we're just waiting for people. And I just thought that was interesting, and I discovered this. It's like,
Karen!
Hey, Barbara.
This looks like.
Hey, did you get my email?
Today?
Yeah.
No, I'm sorry.
Oh, weird. I sent it this morning. Okay.
No, I've been in back-to-back things since
Oh,
5 o'clock
okay.
this morning.
All
I'm
right.
sorry.
Oops. Oops. My notice to get on this call is ringing. Hold on. No worries. I figured you'll get to it. It's a long response. So sorry.
Tonight, it's on the agenda.
Well, I was excited to see you're going to be talking about your project today.
Well, thank you for coming.
Happy to be here. Hi,
It
Wendy.
is 4 o'clock in the morning in Nepal, so I'm not sure exactly when Deep Rajbandani is going to come, but hopefully he said he would try to make the meeting.
My goodness.
That's a noble goal.
That
Well,
certainly
Deep is marvelous. He's a Nepalese national. He's a member of our World Community Service Committee. He is deeply devoted to improving things in Nepal and is excited about working with Rotary to do that. He just joined Rotary about a year ago.
Oh, wow.
And we're just now doing this project together.
Where's he located in Nepal?
Deep has a home in Kathmandu,
In Kathmandu.
but he also has a home here.
Oh,
He spends his time half and half.
wow. Okay.
Wow.
Well, you know, everyone, I want to be sensitive to your time. It's about 5 after. There may be some other people join us, but Barbara and I were chatting as she got on. We do have a couple of announcements here. One I added after the agenda went out, but basically we want to remind people, and I'll put it out in the actions and recap of this, that there's a trip coming up to Guatemala to celebrate the work of Faces for Hope. It's July 1 through 7th. Howard Travel is orchestrating it, and then people out of Cupertino are contacts as well. So there's a flyer about that I'll share with others when I put out those results. I was expecting that we would hear a brief update on from Robert Freeman on the Save a Girl stuff, but I don't see Robert here this morning or this afternoon. And then I do think we have our Jill Durig recommended partners from the Barbados Rotary Club. I think that our principal person is here to speak to that. So if that's the case, perhaps you could, that's Ermin, I'm not sure I'm saying that properly, but if you would like to take us through that briefly, let's just be respectful and recognize that we do have Barbara, who will be sharing this time slot and is our featured presentation for this evening. So with that, if you'd like to introduce yourself and tell us about the project, if you're welcome to share your screen, if you have some things you'd like to show us. So with, you want to take us away with that?
You're muted.
Hi, good evening, everyone. Can you hear me?
Yes, you hear you fine. Thank you.
Okay, greetings from Barbados, the Rotary Club of Barbados. Thank you for the opportunity to talk about our project. So I will just share my screen quickly.
All right, we see your screen.
Okay, let's go in present to view. Okay, is that better?
Yes.
Okay, so our project is, and again, just to give you a quick briefing of Barbados, our club is 61 years old. We just passed 100 members. We are the largest club in District 7030, and we are located on the eastern part of the Caribbean. So the project we intend to take on, one of the projects we intend to take on in the new Rotary year, will fall under disease prevention and treatment, as well as supporting education. So what in recent times, coming out of the COVID-19 pandemic, the rise in NCDs, non-communicable diseases in Barbados, has come to light. The statistics we are now seeing are showing that we have the highest amputation rate in the region. We have the highest level of childhood obesity among children of under 5 years. And this is affecting all genders, all ages. The government of Barbados has called on civil society like ourselves to lend a hand in helping fight the growing rate of NCDs. And we believe that problem is not unique to just Barbados, but also our neighboring islands. And we show with the appropriate research that will show that. So our goal for this project is to go into the vulnerable communities and do early screening and health literacy, run a health literacy program. We also will be running a social media and as well as other forms of media like television and radio program to raise awareness as to the status of NCDs and to get people, get the public aware of what's going on and to take heed. The intention is to run the project for at least 12 months and we can review thereafter. As I mentioned, our targets will be the vulnerable communities and students. Our proposed solution, I spoke about it, to conduct early health screening as well as to raise awareness through data collection and providing that data to the public. Now, in order to do that, we have engaged a few partners to work with us. One of our key partners is Surgical Life Inc., and they will provide us with that medical mobile unit along with a nurse and a driver to go into the vulnerable communities to do the early screening. That unit, it's fully equipped with a private room for examination and other equipment required to run the basic health screening tests. We are also working with other partners like the Ross University. The medical students will assist us with doing the basic tests like blood pressure checks, cholesterol, height, weight, and so on. The Bayview Hospital and Selma, they will provide support in terms of collecting and managing the data and to make it in a form that is acceptable for the health sector in case that patient or that person in the community needs to go to seek further health support. They can get that data from us to move on to that step. So, and like I said, the timeline for that project is in the new Rotary year, which we will launch in July of 2023. Our proposed budget is approximately, that's cash budget, given that we have had a number of partners who have committed to us. We are looking at approximately 34,000 US, and majority of this funding will go towards supply, which would be like the medical kits and everything we need to do the testing. A small amount for equipment, just about 8%, and media promotions, the health literacy part will take on 34% of that cost. And if we were to look at how much have we raised in kind through our partners and Rotarians, we are looking at least 60,000 US. So what we are looking for is our club has already raised 30% of the funding, which is just over 11,000 US. So we are looking to gain some support to cover the 70%. And we have, set it up in a way, since we are looking at a global fund, in terms of what we would require from international funding, which would be about 7,000 for our district. We'll be looking for 6,000, and the matching grant would be about 10,400. But just to reconfirm that we have already raised the 30%, which is the 11,457 US. So I say, why sponsor us? Why partner with us? Our club, we are used to taking on large projects, and I think it's because of the size of our club and the length of time we have been running as an organization. We've already raised quite a bit of money to support that project. We will partner with some reputable organizations in the community, which I mentioned earlier, and that will help us to create impact and to expand our reach. As you can see, the project falls under 2 areas of focus from an RI level, which would be disease prevention and supporting education. And more importantly, that project will create an opportunities for Rotarians and Rotaractors to serve in the community. So that's a wrap in terms of our project and a brief summary. Thank you, Patrick.
Thank you so much for sharing that with us. Do we have questions? Well, if not, I really appreciate you making time. It's what time is it there for you at this point? Are you on?
It's 8:14 p.m.
Okay, well, not terrible, not as bad as in Nepal. So, but we really appreciate it, and we will be sharing this information again with the rest of the international service chairs when we get out the minutes and recap of this session. So, thank you very much for joining us this evening.
Thank you. Thank you so much. And I wish everyone a good evening. Bye-bye.
All right, Barbara, I think unless anybody else has another brief announcement, we'd be ready to have you take us through this evening.
Wonderful.
Thanks so much for doing it.
You're very welcome, and thanks for the opportunity. I am delighted that Deep was able to make it as early in the morning there as it is. So as I mentioned before, early in the meeting, Deep is from Nepal, lives part-time in Nepal and lives part-time in Oakland, and is member of the Oakland Rotary No. 3 Club. And he's been very active on our World Community Service Committee. And we both heard Dr. Richard Godfrey speak about HPV, human papillovirus, and cervical cancer. And we were both thinking, oh, well, we could do that in Nepal. Let's see. So eliminating cervical cancer in Nepal and globally is basically Dr. Godfrey's goal. He used to serve in Nepal when he was with the Peace Corps. So he knows it well. I've traveled there and love it. It's a beautiful country. Kathmandu is the area that we are focusing on. Kathmandu is the capital and the main area, urban area, and there's a lot of rural area around it. So why target cervical cancer? Cervical cancer is the 4th most common cause of death from cancer worldwide, and 90% of those women are in lower middle income countries. In 2020, which is the last, apparently the last census information that we have, 342,000 women died of cervical cancer and 604,000 women were diagnosed. So that represents a phenomenal loss of human capacity. These are women, they're mothers, they're heads of household, they're providers for their families. And the key thing to remember about cervical cancer is that it's preventable. In fact, Dr. Richard Godfrey, who is a member of Rotary and very active in our district regarding cervical cancer, and has a personal goal of working towards the elimination of cervical cancer worldwide. He says that cervical cancer is the most preventable cancer, which makes it very exciting to work on. So he's responding, and we're responding to the 2018 World Health Organization call for the elimination of cervical cancer. And in 12 years, the control targets would be that 90% of girls be fully vaccinated by 15, that 70% of women screened at the age of 35 be free of HPV and or treated, that 70% of women 45 be screened without HPV or treated, and that 90% of those identified with the cervical disease from the screening receive treatment for precancerous lesions, which is what happens, how you prevent the cancer in the first place, and that they also be identified for treatment of invasive cancer if the early diagnosis hasn't happened successfully. So let's talk a little bit about what our goal is with our global grant. And what we are not doing is we are not vaccinating girls before age 15, because that may be step 2 or 3 of the overall plan. In fact, I'm exploring a relationship that I have. You know that I've been working in India on a number of projects with the Mumbai club, the Bombay Queen City Club, and working with an NGO called Prasad Project. And Prasad Project has a trustee who's a good friend of mine, who actually has a good friend who is an owner of a vaccine manufacturer in Mumbai. And so it may be that we're able to put that in place sooner rather than later. I'm exploring that, but that's not going to be part of this global grant at this time. So our focus is on the 70% goal for the women to be screened for HPV and a new kind of test used. Nepal is already using a method called visual inspection with acetic acid. You put the acetic acid on the cervix and you watch how it reacts. And it requires a certain level of expertise to see what that reaction is and to determine whether that there is HPV present. But that's not the most sophisticated form of treatment, of analysis. Right now, the World Health Organization is recommending using a DNA testing. And what's exciting is that Dr. Richard Godfrey has connections with a new technology to be able to do that very easily and very cheaply. So that's what we want to put in place in Nepal. We will also include the treatment of precancerous lesions through a tool called a thermocoagulator, which is far more effective than the VIA that I just mentioned, is now being used many places in the world, including Nepal. So what's going to be used instead is that there are these sampling kits that women can take into the privacy of their own bathrooms and provide those samples to healthcare workers who transport them in a timely manner to laboratories at hospitals. And then the DNA, the assay kits consist of reagents that pull out the proteins, isolate the proteins so they can be tested to see whether or not the cancer, the pre-cancer condition. There are probably 100 HPV viruses, and the 16 and 18 are the ones that are most clinically connected with cervical cancer. And so these assay kits use the samples from the women, apply the reagents, and then go into this machine that I think operates like a centrifuge, and then identifies through data analysis whether or not there is an infection. Then it can be treated at a hospital with the thermocoagulator, which is apparently less painful, less invasive than the current treatments. And then what this project would do is refer out women who with the invasive cancer, because that's really beyond the scope of what we have the capacity to do in this grant. So it's really focusing on this middle group of people who are potentially infected already before they get serious cancer. And then in the future, we could vaccinate, and we could also test even more women. Of course, you would want to know our budget. And we're at this point, we're operating in a flexible fashion. We know what the machines cost. We know what the assay kits cost is $5 to $7 per person. So depending on how much money we raise, we'll just do more women. So, and the goal would be not just one machine, but 2 machines. And why is that? One of the reasons that Nepal is such a good country for doing this project right now is that they have a long history of really stellar public health capability. They have, so FEC Nepal, Public Health Concern Trust Nepal, is an NGO. Here's their website, if you would like to go there. Oh, excuse me, there's no hyphen. I'll apologize. So FEC Nepal is registered with the government, is you know, a very highly recognized and respected organization in Nepal. It has 2 hospitals. And what's significant is that they have an extensive community of healthcare workers, excuse me, who already have quite a long history of working with the community, having built trust, and are very credible. So they are going to be the educational face of this project. And they are going to bring the information. They are going to bring the information. There will be doctors trained. I'll get to that in a minute. And then they will be trained, and then they will do community meetings. Dr. Pradhan is a friend of Deep's and very, very significant. He's the founder and coach and chair of the executive board of Public Health Concern Trust. And he is very excited about this. And so he's really helping push this forward. Who's going to train the doctors on this new procedure? Dr. Godfrey works with PINC, Prevention International of Cervical Cancer. And he's arranging for probably 2 or maybe 3 doctors to come to Nepal, train the doctors that Dr. Pradhan has identified at the 2 hospitals, as well as nurses, and also lab technicians, because the lab technicians need to know how to work with the samples to work with the new machine. And so all that will be part of the training. Then they will train the educational teams. So there's a group called Female Healthcare Volunteers, and there's a group called Women's Groups. And they are the ones who've been involved in the community for decades and have built up a great deal of trust. So they're going to do these screening camps in peri-urban and rural communities of the Kathmandu Valley. And they will show women how to collect the samples in either there or in the privacy of their own bathroom. And then the samples get transported timely to the labs and tested there. And then if the thermocoagulators need to be used for treatment, they can do that in these hospitals. So, so here's a picture of the Kathmandu Model Hospital. Here's a picture of the Kirtipur Hospital. And this is the website for FEC Nepal if you would like to go there and explore yourself. The public health commitment is extraordinary. Lots and lots of community-based education and treatment. So the plan is to do several different areas of Kathmandu proper and areas around that, around the city. Here are more pictures of the Kirtipur Hospital. So if we have time, oh, we don't have time. Oh, well. I was going to run this video that Dr. Godfrey made of Kenya. We haven't done one yet because we're not at that stage yet. But if you're interested for a couple of minutes, I can do that. What do you think, Patrick?
I think that's fine, Barbara. You know, we basically, I didn't see Robert or he came in a little bit late. So Robert Thurman, we can fold him in after you're finished if there's time, but we want to make sure you have all the time you need.
Okay,
So
well, or I could.
You can play this.
questions.
You can play this if you think it's of.
I think it's interesting and fun and useful.
Cervical cancer is one of the highest contributors to cancer deaths in Kenya. So rural community education and teaching is very important.
Is that working?
If we can raise awareness.
Yes,
then
the sound is a little choppy, but it is playing.
Our mission here at Pink is to train local professionals to do these screenings, and they can save lives.
The sustainability of Pink is not just in training healthcare workers at the site. It also is dependent on those healthcare workers being able to teach their local colleagues the same type of procedures so that more women can be screened.
Sana una odin. Ande beach, kawuono emadonyo, nyaka nemi puko pimaga, koro kawuono emadonyo ima. Breaking cervical cancer can be eradicated. As long as there's organizations like Think Around fighting tooth and nail to make it happen, anything is possible.
Thank you. So Ruzinga is an island in Kenya. So I can entertain questions if you would like, or Deep can entertain questions if you would like. I did want to say, come back to the budget issue. We have a starting budget of 35,000, which would be one machine, reagents and sample kits for 2,000 women to be done in one hospital. If we have enough money, we will expand that to 2 machines and as many women as we can possibly fit into a larger budget. So at this point, we have a solid budget created. And what I want to say about that is that Dr. Pradhan has offered so many services for free. We're working with the Rotary Club of Tamil Kathmandu. which is providing, there will be at least the equivalent of $7,000 US in Nepalese rupees for the services that we're going to be doing. But mostly it's going to be provided free as part of this project by FEC Nepal, which is extraordinary commitment on their part.
That just sounds terrific, Barbara.
I'm very excited. In case you couldn't tell.
Go ahead, Jack. I see your hands up, but
Yeah, I apologize for being late. My previous meeting ran over, so I missed the first part of Barbara's presentation, but I saw much of it with Dr. Godfrey last week. We had a long conversation. I'm really excited about this project. I think it really does have the possibility, the potential for sort of leading the charge in wiping out cervical cancer. It really is a disease that could be eliminated if we can effectively use the technologies available now in terms of detection and treatment. It's all very inexpensive and it's all completely doable. So I'm hoping to get our club involved in this, along with our spin-off 501c3, the Global Telehealth, the Child Health and AIDS Prevention Committee. Hopefully we'll be able to contribute something to this.
Thank you, Jack.
Can I just ask for some clarification?
Sure.
So I wasn't able to type fast enough. So 35,000 is one machine, one hospital, and what else?
So 35,000, let me see if I can, hold on one second. So the rotary contribution is this piece, the Amphire machine. So this is the hopeful level of 2 machines, one for each of the 2 hospitals, and enough sample kits, and 2 sets of thermocoagulators for the 2 hospitals, and multiple speculums and brushes and the reagents. So that would be for 7,000 women. And that puts the budget at 73,000.
Wow.
But we can do, we're starting at a place of 2,000 women at the 30, is it deep? Is it 35 or 34? I forget. Anyway, this is, you know, we would love to aim for this if we get enough money to do that much.
I think it sounds fabulous.
No, this is all in,
go ahead, Deep.
yeah, this is all in Nepalese rupees, and on the last, we have, you know, converted in the US dollars. This is all the cost is the Nepalese rupees.
Mhm.
Yeah, on the many columns here are Nepalese rupees, and here's the US dollars.
Mhm. Yeah, it sounds very thorough. It sounds really great.
Well,
love
I
the
could
goal.
run you through all the, you know, that in fact, Nepal is planning to do. I mean, it's really impressive, actually. You know, planning meetings, 2 days of training for the healthcare providers, and then orientation to the female healthcare volunteer services and the mothers groups. And then they're doing the test camps in 3 places, 200 persons, 5 times in 3 places.
Wow.
They're doing the testing of those samples in the 2 the 2 labs that, you know, hiring 2 technicians. In fact, Nepal is doing that. Rotary isn't having to cover that. They're really committed to this project. And then post-treatment would be the thermocoagulators if necessary. As I said, referring out women who have really advanced cervical cancer, because individual treatment isn't possible in this group. This focuses on prevention and early treatment before serious cancer. But, you know, media, there's a bunch of media planned, and educational materials to be printed and flyers to be handed out. And the evaluation of the data. This is going to be useful data for the government to say, oh, well, I guess this really is, you know, more of a serious problem than we thought. And so, you know, we will commit resources to this. That's the whole idea here, is to really raise awareness.
Do you think that after this is implemented that it will continue? Is there a sustainability aspect? Like, do you think FEC Nepal would pick up any of it, or will it just continue because the machines are already in place, the training's already in place? So the doctors and staff that were trained were already, will continue anyway.
Well, both and. So the goal would be to continue testing women in Nepal until we have complete coverage. And the you know, there may be phase 2 of this where we ask for more machines. There are other hospitals and government facilities that could, you know, like clinics that could have these machines. And as I don't know if you noticed that when I had that slide about the machine, that machine can be used for about 6 or 7 other things, not just this. So the machines are incredibly useful. But then the goal would be to just keep testing women in Nepal till we eliminate cancer. And meanwhile, start up the next level, which would be the vaccines to prevent the HPV. So the critical piece to answer your question about sustainability is paying for the sample kits and reagents, because that's $5 to $7 a person at this point. And that's, you know, it's a cheap cost, but it is a per person cost. And so we would have to find a source for that. Now, my goal would be to show how successful this project is and say to the government, and the president is a friend of DEEP's, we should, you know, the government should fund the cost of the reagents and sample kits.
That's part of the power of this particular grant, is that it provides a proof of concept that shows it can be done. It involves tremendous leverage of the investment that we put in the context of the global grant. You know, Barbara's talking about all the other funding they're putting in at that end. And when you're done, it's going to have the potential to scale not only in that country and be sustainable there, but also provide a model for other countries. Like Dr. Godfrey is convinced that it's possible to completely wipe out cervical cancer in Belize. And they've started there. But if we can do this in Nepal, that will provide further support in terms of the concept of completely wiping it out in the country of Belize as well. So it's going to grow. It won't just be there in South Asia. It'll be potentially all over the world that this goes eventually because of this grant happening.
Are there more questions or comments for Barbara or for Deep, or for Jack? I mean, he was in recent conversations with Dr. Godfrey about this.
I think it's exciting.
Well, thank you all for being here and listening, and please take it to your clubs and let us know if we can keep leveraging more money, more women.
All right. Well, if you don't need more time, then Barbara, if Robert, if you'd like to go ahead and give us an update on the Save the Girls progress, that would be most welcome. But I want to make sure, Barbara, that any
I'm
questions
done.
or comments.
Unless Deep, did you want to say anything more?
Only the present situations, as you know, as per the report, you know, every year 2,000 women are dying from this cancer in Nepal. That's the worst part. That's the reason we are trying. That's all, ma'am.
Thank you.
Thank you for joining us, Deep. I know it's a quite different time zone where you are, so thank you.
Yeah, it's early morning, yeah. 6 o'clock.
Okay, Robert, do you want to go ahead?
Be very happy to. Pat, can you hear me?
Yeah,
Okay, I apologize too for being late. I had doesn't matter why. Here I am. And I promised you I'd make this in 5 minutes, and so I'm going to do it. As you know, the Global Uplift Project is working with 5170 to provide Save a Girl kits to girls in the developing world. The 30-second summary for those of you who don't know about Save a Girl is we've created a washable, reusable sanitary pad. Costs $6 to make. It lasts for 3+ years. We give them free of charge to girls in the developing world. One kit comes with, well, here I've got it right here. It comes with a washable, reusable pad that comes with 8 of these. And it comes in a little thing that sits into the panties. It's waterproof. And this thing absorbs the flow. When it gets full, as I say, there's 8 more of those. Now, I've got to give acknowledgement to Los Altos Club. We've been working with them for more than a decade, and they are the first club who picked up on this and said, this is a great idea, and started us creating them. We've produced now more than 50,000 of these kits that we've given to girls in 9 developing world countries. I see we've got a couple of folks on here from Palo Alto Club. I have to acknowledge them also, because last year they got together with Livermore Club and San Ramon and funded a sewing center in Tanzania that's making Save a Girl kits. Right now, in the existing relationship, we're supposed to make and distribute 3,750 of the kits in Kenya, Nepal, Tanzania, and Cameroon. Cameroon is new, and part of the agreement with 5170 is we would bring up a new sewing center in West Africa to serve girls in West Africa. We're doing very well in East Africa with Kenya and Tanzania. And we're doing very well in South Asia with Nepal and India. Of the 3,750 kits we're committed to provide, we've delivered, that is distributed to the girls, 2,788. We're supposed to be finished by June, so we're ahead on every single metric. In Kenya, we've distributed 1,808. In Nepal, 550, and in Tanzania, 350. For those of you who don't know about this issue of adolescent female menstruation, when a girl reaches puberty, obviously, if she can't manage her period, she starts missing school, 3, 4, 5 days a month. Very quickly, she falls so far behind, they end up dropping out of school. UNICEF says 20 million girls drop out of school every year because they can't manage their period. It is the most preventable human tragedy in the world. And it's preventable because the solution is one of these kits. It costs $2 per girl per year. Keeping a girl in school for $2 a year is probably one of the highest returns on human investment in the world. Better educated girls, World Bank says, better educated girls, they defer sex longer, they have fewer partners, they're more likely to use birth control, they marry later, they have fewer children, they make sure that their children are better educated, they have better vocational options, they contribute more to their communities. It's unbelievable the ripple effects of getting girls better educated. Now, if all of that sounds like hyperbole, it isn't. All of what I just told you is a fact. Here's the thing that sounds like hyperbole, but I think it's not. This is one of the most reliable, proven, inexpensive, granular, linear paths to improving the human condition. Now that sounds like hyperbole, but what I just told you is not. It holds the potential of liberating another half of human potential that is not fully in play right now. And it's $2 per girl all the way from here to that other half of human potential being liberated. There's no new cures for cancer that got to be invented, no new laws of physics that have to be discovered. And so I know it sounds like hyperbole. I don't think it is. I've got the true religion because I'm out there all the time with the girls. You cannot believe the thrill a 12 or 13-year-old girl experiences when she realizes she can stay in school. You know, she's not going to be sold as a child bride or sold into the sex trade. Anyway, I hope I hope my enthusiasm is coming across. I hope it's I think it is grounded in facts. I'll be happy to answer any questions that anybody has. Long and short, we're more than on track. We're ahead of schedule. And I want 5170 to help recruit other districts to do the same thing. 5150 up in Belmont, up north San Francisco. They've actually put in many tens of thousands themselves, but it's come from individual clubs. It hasn't been a district-wide effort. If we can get other districts around here to do the same thing, we'll be able to help. There's no reason we can't help hundreds of thousands of girls, $2 per girl. That's
Robert,
my,
you've got
explanation.
Jack. Jack's got his hand up, and then Barbara.
Okay, Jack, go ahead. Good to see you.
Just as the token doctor in the group here, I want to reinforce what Robert's saying. It's not hyperbole. It has an enormous impact, and we've been involved, as he said, for I guess a decade in doing projects both with him and separately. Also, other projects that involve whatever they're called by that particular organization, the girl kits or Save a Girl kits or whatever. By various names, they're basically that. They are in fact saving these girls from early marriage, early baby making, and allowing them to be educated and join the workforce. So it has a tremendous impact.
Thank you, Jack. Barbara, did I see, was it you that had a question?
Yes, I have a question. Would you please explain the relationship between Savita's district project and what you're doing? Is it one and the same?
It is one. No. Savita's district project is larger. She approached us in January, and she had the idea for what she called something liberation through hygiene. She's raising $100,000. Okay, she came to us because we are a specific manifestation of what she wanted to do. 5170 has given $12,500 to the Global Uplift Project on the proviso that would be matched by District 5150, just north. And in fact, 5150 came through. So we have received $25,000 from the two organizations. The rest of the 5170 target up to Savita's goal of $100,000, she is handling that. They're doing something of that on their own. Is that clear?
Yes. So if a club is contributing more to your organization, that would be above the 25,000, because we've already contributed, our club has already contributed to the district initiative with District Governor Savita. So I was
Mary told me last Thursday, you guys have contributed $5,000, she said, to the district initiative. Yes.
And so our club could contribute more to your organization. That would be a specific if we wanted to do that.
If you wanted to, but I'm not here to recruit funds. I want to be real clear about that. I'm simply here to update what we're doing with 5170. And it's at least our part is very, very successful. As I said, ahead of schedule. We're now manufacturing the kits in Kenya, Tanzania, Cameroon, Nepal. We've got two groups in Nepal, one that makes them, and then they hand over half to another group because as you know very well, Nepal is such a mountainous country. It's very difficult to serve from any one locale. Anyway, long and short, I hope I answered what I can of your
thank
question.
you so much. I appreciate it.
And I enjoyed meeting Mary. I spoke at your club last Thursday. Were you there?
Yes, well, not in person. I was there on Zoom.
Well, I hope, you got to see the whole presentation then.
I did. Very good summary in 5 minutes.
But yeah, Pat, I'm going over my time here. I promise.
Oh, no, that's okay. Karen's got a question for you. This is Q&A for you. So here's a question from Karen.
I want to say, if anybody out there is on a club that wants to see the presentation, maybe Mary can comment or anybody. It's very dynamic because it's showing what we're able to do, you know, to improve the human condition. I'll shut up. Karen, how are you? Good to see you.
I'm good. Good to see you too. I'm so glad you're doing this. You're doing such good work and we're so happy to work with you. But I did want to ask, I just want to understand a little bit more. So if Savita raises more funds, she's only putting 25,000 to the project through TGUP? Or if she raises 100,000, is that all going? Are you going to manage all of that? Like that's a lot, right?
We only received 12.5. The 25 comes because there was a proviso that each of 5170 and 5150 would put in 12.5 if the other matched. 5170 has put in 12.5. 5150 has put in their 12.5 to match. So we've received 25, but we've only received 12.5 from 5170. All the rest of what Savita is doing with the rest of the 100,000 is her business. And I don't know what that is. I just don't know. I don't have any comment on it.
I just assumed she was going to do it all through you. So I don't know what else she's doing. So this is okay.
If I would unmute.
All right, good to see you.
I think that there are various geographies involved. Karen.
Okay, that makes sense.
So I think, and I've lost track of the details, but I believe Robert's involved in one geography, and then they've got some other partners in other geographies. So
gotcha. Okay.
I can say I know this. Geeta was in India very recently for like 3 weeks, and she was looking for partners there, including Rotary partners in India, who could be the recipients of not just the funds from 5170, but potentially from a global grant. So it's very ambitious, and I'm really glad to see it. I mean, there's an effectively infinite, or at least an eternal need for this, as long as humans have to recreate the way they do. And so all the better.
Oh, we appreciate what you're doing, Robert. It's great. Really great.
Thank you very much for joining us. And sorry about the wrinkle, but it worked out well. So we were able to wedge everybody in this evening, and Barbara was able to take us through this really exciting prospect of being able to deal with the cervical cancer. And so that's exciting. Good stuff indeed. And it was good to hear from our Barbados colleague this evening as well. And so
thank you, Patrick, for the opportunity.
What do others have things they would like to share? Does anybody have any announcements they want to get out to folks? Jack?
Mm-hmm. Just very quickly, we weren't able to get in time to have a full at the district conference. We wanted to have a breakout session talking about our global telehealth project, and February was too late to get on the schedule for that, but they agreed to let us do something in the third round of breakout forums right there in the House of Friendship. So at the same time they're breaking down, basically at 3:45, we'll be starting up with a brief session about the work we're doing to telehealth to try to spread the word to the other clubs in the district so that perhaps others want to get involved. It's pretty exciting stuff that's happening right now. And we think it has the potential to make a really big difference, not just in Kenya and Uganda, where we're starting with the pilot projects, but across sub-Saharan Africa and other continents as well. So we'll have that time to talk about that. And if you stop by the booth in the House of Friendship, we can tell you more about it. And I just learned today that we will, in fact, have a booth at the Rotary International Convention in Melbourne as well. We'll be partnering with our lithium-ion battery recycling project. So Clary and I will be doing the booth basically with a few other people helping us. And it'll be headed Los Altos Rotary Club on top. And then we'll have the two projects basically that we'll be talking about in the booth. So if you make it to Melbourne, stop by. Thanks.
Oh, that's great. Thanks, Jack.
Yeah, Jack, do you also want to talk about the gala?
Yeah, good idea. The club has, I'm really grateful that after I gave a talk to the club in January about what we're doing with global telehealth in Kenya and Uganda, Stan Scardino, our president, decided he wants to make it a club project, and our president-elect has said he wants to do the same. So they're doing a benefit for us. It's a gala celebration at the Fremont Hills Country Club in Los Altos Hills on May 19th. It'll be a dinner entertainment by the woman who is star of the Beach Blanket Babylon program, if you ever saw that in San Francisco before they closed it down. She'll be singing. There's another band playing before and after, and it'll be a nice dinner with an auction and so forth. And if you're interested at all, just go to our website, Los Altos Rotary, and there's something on the front page there about how to sign up for seats. Thanks.
Great. Anybody else before we wrap it up for this evening?
So Patrick, I put it in, because Robert was a speaker last week at our Rotary Club and we videoed him. So I just put that in the chat if anybody wants to hear more about Global Uplift and all the stuff they do.
Great, thanks, Oren.
I'm speaking at Saratoga Club next, I think it's Thursday, the 28th. It's the 28th, whichever day of the week that is. I think that's Thursday.
That'll be a week from, yeah.
Yeah, and so if any folks are in clubs who haven't seen the presentation, send me an email and we'll find a way to come by and share what we're doing with your club. Thank you. Lee?
Hi, yeah, Pat, can I give a real brief summary of where we are on Rachel in Guatemala?
Sure.
Okay. We have installed the Rachel units for the global grant number 2, which is David Gilpin's grant. Final report, kindness of Pat, went in on Rachel 1. Did we ever get a response about that? Was the report accepted?
It will come back to Kamal because I was using Kamal's credentials to get that report in there. I haven't heard from him whether it has been accepted or if they still have issues with it. So you might want to pulse him and see, Lee.
Okay, excellent. So Rachel 2 got a late start for various reasons, but we're in, I believe, 9 schools. Is that correct, Pat? God. And down in the Solala area of Guatemala, and this is installing the Rachel units in select elementary schools, along with a little bit of teacher training how to use them. And it's basically a computer lab for kids in those schools who heretofore have had nothing but 4 walls and oftentimes no paper, pencils, or texts. And so now they can go to a computer lab and through the magic of the Rachel units, access online materials that expose them to basically everything that's out there in every subject. So it's very, very exciting. We are now working on Rachel 3, which I will head for the Rotary Club of Dublin. And in Rachel 3, after making the trip in February, the folks came back and said, you know, the teachers would love to have Elmo units and projectors to be able to use a Rachel unit in the classroom. So we're just at the investigation phase, looking if that were possible. Number 1. Number 2, we're looking at new assessment measures, which is last time was extremely difficult because we hit the pandemic and can't assess kids if they're not in class. You know, if they're not there to be assessed, right? The school's closed down. And, you know, they can't have Zoom. So anyway, we're proceeding and we hope to get that underway in the developmental stage. And it's all extremely exciting, but we're very supportive of the Rachel units in Guatemala and we're moving along. And the Rotary Club of Vista Hermosa Satellite has pledged $15,000 their district toward the global grant. So that's exciting news indeed. So that's where we are.
Thank you for the update.
All right.
All righty. call it a wrap for everybody. Last call. Thanks again, Barbara. Thank you, Deep, for joining us. Jack, it was a real pleasure to hear your comments on this as well. And thank you again, Robert.
Very welcome. Thank you.
Thank you, Patrick.
Thanks, Patrick, for setting this up.
Thank
Good
you.
night, all.
Thanks,
Night,
Patrick.
everybody.
Everybody.
Good
Thanks,
night.
Robert. Thanks, Barbara, everybody. Bye-bye.
Thank you.